Welcome back to class. My name is Mrs. Olaiwola, as you all know. This semester, I'll be taking you through NSC 503, which is Maternal and Child Health Practicum. And this lecture for today will just be an eye-opening for what we are going to do in NSC 503, which is the practical introduction. Practicum is intended to provide hands-on experience in the field of maternal and child health, which is an essential part of BNSC program, and it is embedded in maternal and child health curriculum. It aims to provide you with opportunity to apply and test maternal and child health concepts and theories, which you have learned in the course of work in the practical setting, so as to improve your learning related to the program of maternal and child health competence. The practicum is a 2 credit unit which will be conducted in partnership with an agency, community, ministry or organization that is providing a maternal and child health services, which may include hospitals, ministry of health planning units, primary health care agency, non-governmental organization, and any other organization providing health service in broader sense of public health or non-governmental organization. The aim. The objective of the practicum is aimed at giving the student the opportunity to participate in an ongoing intervention program and activities as local government, community, and also health care facility levels. The students are expected to produce reports on the health system, research based on their experience at the different levels of activities. The ethical and professional conduct that is expected from the student during this course of practicum. As a trainee in maternal and child health department, the student must also adhere strictly to the ethical conduct of the practicum organization, including dress code, time of operation, and any other related conduct applicable. You can see this image showing this is a recommended uniform or scrub for a student nurse on duty. Others at time of operation. When you are supposed to be there, you must be there, and any other related conduct that is available. Students must exhibit commitment to excellency, honesty, and integrity and respect for others in the place of primary placement. The objective. At the end of this posting, the students should be able to participate in community care of mothers and maternal and child health facilities. They should be able to provide preventive and assistive care to mothers and their children aged between 5 and under. Also engage in community mobilization activities through health visits, health education for prevention of sexually transmitted infection and other diseases, and also to provide counseling services to adolescents, couples in need of family planning service. The objectives to continue. You should be able to demonstrate knowledge of maternity care services. You should be able to demonstrate fieldwork leadership ability and teamwork ability. You should be able to work with yourself personally and also work with others. Also be able to demonstrate understanding of role of a midwife in the community health intervention. You should be able to claim measurable practical objective as community health worker. You should be able to develop ability to interact sociably with a given community. You should undertake in a community-based assessment and also propose how the community can address its health needs. You should be able to organize, plan, and also participate in a public health improvement program so that you don't leave the community the way you met it. and also develop health education material based on the culture and religion of the community. The activities during practicum, which include participation in all clinic activities, provision of antenatal care, routine care to mothers and babies, monitoring of mothers in labor, health educations, counseling, and also immunization. You should be able to conduct home visits and follow up. You should be able to conduct child welfare clinic, immunization, proper recording, and also reporting. Documentation. Documentation is a very important aspect of practicum, particularly a concise report. It is expected to be submitted at the end of the practicum. Also, during the practicum, the student must ensure proper documentation of the following: all activities carried out during the practicum, while listing the most important activities of the period. That may include dates, time, as needed for clarity. Activities such as interesting meeting, either group meeting or individual meetings, duty assigned, other organization visited, training completed, and projects that was worked on. The documentation continues. Key learning experience should be included and not more than 1 or 2 paragraphs. Students must also demonstrate ability to concisely produce a report of all the activities carried out are as added to his knowledge base and related to the theoretical aspects learned during the course work. These are examples of documentation. You can see the serial number, the week, the activities that were carried out, the dates, what is the objective, and the remark that must be filled and submitted. The final report and delivery. At the end of the practicum, the student shall submit a written report of the practicum experience, and the final report should be a concise summary of the program indicating why the work was done, the goal and objective, the method by which these were achieved, and also evaluated related products that were created and results obtained. Also, discussion of the impact of practicum activities and recommendation for future activities to be sponsored by organization and the field or research. Also, the write-up for submission to the department should be as outlined in an already uploaded seminar format. Grading. At the end of the practicum preceptor which was identified by the study center will be responsible for monitoring the progress of the student during the practicum. Weekly documented activities carried out as documented by the student will be submitted to the workplace preceptor for check and grading during departmental visits. The final grade will be the sum total of the field work, graded by the department, which is cumulatively 60%, and the submitted practicum report that will be graded over 40%, and the score practicum reports to be presented by the student at the end of the exercise will constitute the final grade of such students. Conclusion: the practicum, which is an academic experience, will be graded through the preceptor marks and the mark attained after the submission. Summary: the procedure for the practicum are clearly highlighted. Identification of practicum organization, planning, execution, and proper documentation. The aim and objective of the label must be clearly outlined and achieved by all students for the practicum to be accepted. Thank you. See you in next class. Bye.